Namavi Dhanvantari. I am going to present seminar on Ayurveda stress management, Ayurvedic perspective.
अभ्यास झाला म्हणून तू अभ्यासासाठी काय केलंस तुझे
Stress management consists of following subheadings. It has definition, types, causes, signs and symptoms, and management.
आणि म्हणजे तुम्ही तिथे येऊन बोलता ना
Definition of stress is it is a state of mental or emotional strain or tension resulting from adverse or demanding circumstances. In this Manohasrotas will be affected. Vata will be increased in the Manohasrotas or Kapha will be increased in the Manohasrotas. Types of stress are physical. There are three types of stress. They are physical, emotional, mental stress. Physical stress is due to increase in kapha. Kapha increases in all the srotas of the body. Emotional stress is due to increase in pitta. Increase in pitta. The third type of stress is mental stress. Is due to increase in vata. There is the dhriti and shruti vibramsa. Due to mental stress, memory will be decreased or there will be loss of memory and also there is lack of proper decision making. Causes of stress. Stress affects all age groups. It mainly all age groups like Bala, Yavana, and Vridhavastha stress is affected. In Balyavastha, that is in children and teenagers, stress is increased due to exams. due to competition in class, and is also increase due to friends sometimes, due to quarrel among friends. In adults, stress is increased due to lack of job or more uh, targets in work, unreachable targets in work, less time. In addition to this, there is broken relations in the family. Also, secondly, there are love failure among adults. Also, in addition to this, thirdly, there is uh, no proper matches to marry. Coming to Vruddhavastha, there is coming to Vruddhavastha, there is property problems. Uh, Income tax should be paid in time, and correct income tax should be shown. There are also health problems in the oldest people, like health problems like cardiac problems, respiratory problems, health. This all lead to a lot of stress. Also, if there is any stroke or paralysis, patients they are a lot of stressed, and attendees also feel a lot of stress to see them, to take care of them. Signs and symptoms, system wise, signs and symptoms. They are respiratory symptoms, digestive symptoms. Respiratory symptoms include irregular breathing, or lack of proper breathing, increase in asthma levels if it's already present. Digestive problems include lack of proper appetite, bloating of abdomen. There is increase in loose motion due to anxiety, So third one, in cardiovascular system, there is palpitations, tachycardia, increased heartbeat. There is angina, heart pain. Also, there is increased blood pressure. In musculoskeletal system, there is a lot of body pains. There is neck pain, shoulder pain, back pain, joint pain. Fifth system is nervous system. In this, there is nervousness, feeling agitated, tremors of body, tremors of hands. Also, there is anxiety and depression. In reproductive system, there is dysmenorrhea, pain during menstruation. There is infertility, male infertility and female infertility. There is premenstrual syndrome. Seventh system is excretory system. In this, there is increased micturition during anxiety. There is bloating of abdomen. Gut-brain barrier gets disturbed. And there is sometimes constipation. Other times, there is uh, loose motion in anxiety. Management. Management is by under management. There are many ways of managing stress. In initial levels, depending on whether it is initial level or intermediate level or advanced stage of stress. It also depends whether it is acute or chronic. Chronic since years, 2 3 years, or acute since 1 month, 5 days, or 10 days. Under management comes lifestyle modification. Secondly, yoga. Third, pranayama. Fourth is my medication. During early stages of stress, it can be managed by lifestyle changing, yoga, pranayama, and meditation. During intermediate stages, lifestyle changes, medicine uses some using medicines, and mild panchakarma is helpful. During advanced stages, you lifestyle changes, medication, aushadhi, and panchakarma procedures. Advanced panchakarma procedures are highly suggested. And also there are other treatments like aromatherapy, acupressure, or nowadays um, very popular in controlling stress without use of medication. Also in Ayurveda, there are Daivi Vyapashraya Chikitsa, Yukti Vyapashraya Chikitsa, and Satvavajaya Chikitsa, like Trividha Chikitsa in management of stress. According to Charaka Samhita Sutrasthana Triyashniya Adhyaya, where these three modes of management we can control stress. Also in Charaka Samhita Chikitsa Sthana Rasayana chapter, there is Acharya Rasayana. Uh, it's a sattvic way of life, which comes under a preventive aspect of stress. Finally, music therapy also helps in controlling stress. Lifestyle include Lifestyle changes include uh, proper intake of having proper food, vihara and nidra. That is, as said in Gita, युक्ताहार विहार युक्तचेष्टस्य युक्तकर्म स्वप्नावबोध योगो भवति दुःखतः. By having proper food, sleep, and proper vihara, exercise, they helps in overcoming stress and dukkha. Overcoming unhappiness. In ahara, following Ashtavidha Ahara Ayatanas, following proper dietetic rules, like the food should be lukewarm, we should have it. It is We should be snigdha, that is using cow's ghee. It is sattvic, taking less spicy food, less oily, decreases many of the improper lifestyle diseases. And vihara includes proper exposure to sunlight, doing doing being in sun morning some 20 minutes, evening 10 minutes. That is between morning 7 to 8 and evening 5 to 6 helps in getting vitamin D and decreases stress. Researchers show that having proper sunlight decreases depression levels. Also in Vihara comes Vyayama. Ardhashaktiya Nisheviyastu Balivihi Snig. That Vyayama should be done half of one's own capacity. In addition to this, Shankramana, that is walking 20 minutes daily in either treadmill or outside walking in nature helps a lot in anxiety patients and depression patients. Having proper sleep, that is 7 to 8 hours daily in proper timings, that is from 10 to 5 or 6 a.m. is highly recommended. Ati Nidra and Anidra should be avoided. Anidra leads to anxiety and Atinidra leads to depression. So this should be avoided. Yoga's doing asanas like Savasana, Amrutsalyasana, Yoga Nidra. These all asanas can be done for 20 minutes regularly helps. Many researchers showed that Yoga Nidra helps in decreasing anxiety. Pranayamas like Anuloma Viloma Pranayama, Brahmari, or Shidali Pranayama is helpful in insomnia. Basrika decreases depression. Kapalabhati also decreases depression. Medications there are single hair formulation, multi hair formulations. Also there are Ayurvedic churnas, guttis, asvas, aristas, kashayas, tailas, lehyas, kritas. To overcome stress. Single hair formulations like Ablaki, Ashwagandha, Brahmi, Bringaraja, Jatamamsi, Shankapushpi, Tagara, and Estivado are highly recommended. These formulations can be taken in churna form at a dose of 5 grams or 1 teaspoon twice daily with lukewarm water. Coming to the properties of these individual herbs, Brahmi is a memory enhancer. It increases concentration, is anxiolytic, nerve tonic, used in attention deficit hyperactivity disorder. Jetamancy is anxiolytic, anti-stress, it is anticonvulsant, it calms down the nervous system, also is anti-aging, in addition anti-inflammatory also. It is cognition facilitating, that is memory enhancer and increases concentration. It is nerve tonic. Secondly, it has some diuretic properties, so it lowers stress related hypertension. Third single herb is Tagara. Tagara properties are Tagara does karma like uh, uh, anticonvulsant, antispasmodic, Nidra Janaka, it's antidepressant, and anxiolytic decreases anxiety. Valerianic acid increases GABA concentration and decreases CNS activity. It induces sleep also. Himalayan tablet, Himalayan recovery has Tagra tablet which can be taken night uh, to decrease insomnia due to stress. It can be used for 5 days or 7 days in acute cases of insomnia due to stress. Fourth drug is ashwagandha. Ashwagandha is anti-stress, antioxidant, immunomodulatory, and it is anti-inflammatory. Ashwagandha churna, 3 grams, uh, twice a day with milk, induces sleep, decreases body pains, joint pains due to stress. In addition, thirdly, in infertility it can be used, which is due to stress. Also, it decreases vata levels, it does decreasing tremors, agitation, irritation, etc. Fifth individual herb is Arjuna. Arjuna terminalia Arjuna. It is best cardioprotective drug. Whenever in anxiety there are cardiovascular symptoms like increased heart rate, respiratory rate, increased blood pressure, palpitations. This Arjuna is the best drug of choice. Arjuna can be given in the form of churna or can be given in the form of Arista, Arjuna Arista. Arjuna Arista 15 ml with equal water twice a day helps. Also, there are Panchakarma procedures like Sirodhara, Siro Abhyanga, Siro Basti, Siro Pichu, Matra Basti. Siro Abhyanga with Brahmi Taila, Siro Pichu with Brahmi Taila, Matra Basti is Brahmi Taila, decreases stress. Siro Abhyanga with Brahmi Bringrasa Taila, decreases headache due to stress. Also, coconut oil Abhyanga decreases pitta and decreases stress. In addition, there is aromatherapies. Aromatherapies with essential oil like lemongrass oil decreases is a good antidepressant. This lavender oil, sandalwood oil, peppermint oil, essential oil, rosemary oil, basil essential oil. These all oils can be used in aroma diffuser or while bathing 5 to 6 drops with hot water reduces stress. Using this with aroma diffuser while meditation decreases stress. Also, there is Daivi Yapashraya Chikitsa in Ayurveda by using mantras, aushadis, by homas like Grahashanti homas, Rudra homas, also highly helpful. Also, Yatra Gamana going to tours, nature tours, or going to spiritual places helps in decreasing depression. Uh, with Trivida Chikitsa, there is second Chikitsa, Sattva Chikitsa. This in this controlling the mind from unwholesome sense objects is prescribed. This can be done through jnana, vijnana, dhairya, smriti, and samadhi. In Sattva there is increase in Sattva guna and decrease of Raja and Tama guna. Also, Acharya Rasayanas, following Acharya Rasayanas, uh, is described by Charaka, helpful in preventive aspect of stress. That is following proper social behavior and individual personal rules like ahimsa, satyam, and also individual following individual rules like reading spiritual books, adhyayana, tapas, doing penance, uh, being neat, following cleanliness are highly recommended in preventing aspect of stress. Also, so following this all, stress can be overcome. Thank you.